Well, hello. I am so happy to be together with these brilliant people that we have in our congregation. I have Belinda Jordan and I have Thomas B. Henderson. And we're going to talk about this wonderful discussion that we have right now that's looming ahead of us is open enrollment. So it's a discussion, but also we're going to welcome you guys to also feel free to share any questions that you have in the chat. We'll make sure that we try to get to it. And if we don't have an answer now, we'll try to get back to you at a later date because we want to make sure that everybody is encouraged and everybody knows exactly what we want to do. So I would be remiss if I did not ask for the Lord's blessing in this time. So a quick word of prayer. Father, we thank you for those who are listening, those in the audience. God, we thank you, Father God, for these professionals who've taken out time to just discuss the things that we don't know or understand, God, and help us to navigate it very well. So, God, I thank you, Father God, for the presence that you have here and for the questions that will be answered today so that we can all make good decisions, whether or not we're going with the Affordable Care Act with Obamacare or whether or not we're going through Medicare supplements. We just want to understand the questions to ask these people. So we love you and thank you for that and their brilliance and their time. In Jesus' name we pray. Amen. Amen.
Amen.
So thank you guys for being here. First of all, I just want to ask you guys, first of all, what why is it important for us to even understand this whole open enrollment and this marketplace and all these other things that are going on? Why is that important to us today?
Well, you want to go first,
No, you
Thomas?
go first, Belinda. Go ahead.
So one of the big issues, especially, is that people don't understand what their options are. They don't understand what their choices are, and so a big important part of understanding, when can you enroll? What are my choices? It really takes away a lot of the fear because I find that there's a lot of fear and people are afraid of making the mistakes. So that's why it's important to just be educated about what your options are and how to make them and who to trust.
And I'll just add on to that. One of the things, especially about Medicare, that people make certain assumptions about Medicare. That's something that you qualify for when you're age 65, but then there are a lot of other caveats that go along with that as well too. And a lot of people don't know that. In fact, even working along with Sister Belinda, I've learned so much more about, the Advantage plans and the supplements and all of that, even though I market those products myself, but someone who works in that every single day, I learned so much from her. But then the other piece of that is that a lot of people don't even know about the open enrollment period. They miss that very critical time period in which they can sign up for these kinds of health benefits. So that's something very important for you to know too.
Exactly. Particularly
Yeah,
with Medicare, I would just add, particularly with Medicare, people think they assume that the government is going to put them on Medicare, and that's not necessarily the case. And so when people don't enroll in time or they don't make the proper elections at the proper time, there could be penalties that are just associated with that. So we really want to make sure people understand what their options and choices are.
that's good to know. I don't know if everyone knows that they do have that option. And hello, Mrs. Stella. Thank you for joining us. And all of you who are on Facebook, we are so glad that you are on in this discussion today. I think this is a really important discussion as you all get your questions together. I really want you all to be able to answer that. And so I want to go to the question regarding Medicare supplements. And hello, Rose. We're glad for you to be on as well. Thank you for joining us today. One of the things that I wanted us to look at or even just discuss, and this is a really probing question. If I'm considering this, changing in Medicare supplement, what are some of the questions that I should ask myself as a consumer, when I'm talking to these different, people who are offering all of these plans. We see it on television, we see it, we hear it on the radio. I mean, we're inundated right now.
Mhm.
What are some of the things we need to consider, guys?
I think one of the biggest things to consider is people need to understand the difference between a Medicare supplement and a Medicare Advantage plan. I find that most people think they're the same, and they're not. They're totally different. Medicare supplement, they're offered by private insurance companies, just like Medicare Advantage plans are. But the main difference is that Medicare supplement plans are designed to be like a wraparound for Medicare Parts A and Part B. So you can have Medicare Part A and Part B. They don't cover everything. And so a supplement gives you the ability to fill in the gaps of what A and B don't cover. There's a charge for them monthly to have a Medicare supplement. And there's reasons why people choose to go that route versus a Medicare Advantage plan. But people need to understand the difference. A Medicare supplement and a Medicare Advantage plan, they are totally different, and they do different things.
And I think too that Belinda has been able to present when we've done presentations together. She has a great chart that she's able to show, because a lot of times because people don't know what the various parts are of Medicare, in terms of the supplement, or even Medicare, as Belinda was saying, the fact that you may mention parts A and part B, part C and part D, but a lot of people, those are letters of the alphabet, but what do they really mean as
Exactly.
it relates to those particular kinds of products?
Yes.
And especially if this is an audience that comprises of people who have not yet, met the Medicare age requirement, for signing up, this is very informational. So that way you can be prepared, because especially for those people who are maybe caring for loved ones who may be approaching that particular age, they may not be knowledgeable of those things themselves, but they may find themselves in a position where they have to help understand, or help someone to understand, what those products are. So I think that this is very important, that she makes that differentiation between the supplement and the Advantage plans.
Mm-hmm.
And
Exactly.
hello, Deborah Coleman. We are glad that you're on. And also, Carolyn, and all those of you who haven't even said hello, we're glad that you're on as well, listening to this conversation. So, we're talking about right now the difference between the Medicare supplement versus the Medicare Advantage. And I think that is just a good point that you brought that out, because most of us didn't know that there really is a difference. I mean, we hear all these terms and they all seem to be alike to us.
Yes. And it's just, it's a lot. And typically I do, and I've done this with Thomas, we do like a Medicare 101, which just kind of walks through all the different parts. And I know we can't cover all that in such detail, but I will summarize it to the point where when we talk about someone who becomes eligible for Medicare, that you could become eligible when you turn 65 if you have enough work hours. And so sometimes, and people don't realize this, if you haven't worked and you're not married to someone who has worked, you may not qualify for Medicare, because you have to work what they call the equivalent of 40 credits, which in Medicare terms equates to about 10 years of working. And so once you qualify for that, unless you have a qualifying disability, then you qualify for Medicare at age 65. There are some people who have qualifying disabilities. They say they're on disability and they've been on disability for 24 months. They also qualify for Medicare. Or someone who has end-stage renal disease, or someone who has ALS, they qualify for Medicare, and they don't have to be 65 to qualify. So that's important to understand that. Sometimes people don't know that. But once you become eligible for Medicare, Parts A and Part B, Part A is all the parts that go along with going to the hospital. When you get Medicare and you get Part A is what Medicare covers when you go to the hospital. There are deductibles that go along with that, which is, we talk about that Medicare does not cover everything, but it does cover a lot. And so people need to understand, when you get Medicare, you could have some out of pocket. And so understanding what those out of pocket costs could be and how to fill in the gap. I think a question down the road is Medigap. We're going to talk about that, because Medigap is it's the other name for Medicare supplement. And so those products that are offered by private insurance it's an insurance policy that helps to cover the costs that Medicare does not cover. And so when you say you want to, someone say they qualify for Part A and B, A is hospital, B is for your doctors, for your outpatient, when you have to go have outpatient surgery, when you have to go see specialists. B is a part of Medicare insurance that covers those kinds of costs. And when you have Part B, there's a monthly cost for Part B. There's no monthly cost for Part A unless you are a high income earner. Let's say you're in retirement, you're making $100,000 in retirement. Well, then there may be some cost for Part A. But most people, there's no cost for Part A. That's what Medicare offers you. You just have to meet the deductible if you have to go to the hospital. But for Part B, Medicare covers 80%, and you cover the 20%, whatever that is, if you have nothing else but Part A and Part B, which is why the supplement or the Medigap is so important, because it helps to fill in the cost that Medicare does not cover.
Yeah. And from Breckenridge, I think that one of the points that we covered in another presentation, I think that Belinda just does this so well, is the fact that there was a question that was asked. And I think it's a very important one, because a lot of times that people don't understand that, or they ask the question that, what if I'm still employed?
Yes.
And, maybe at a full-time job. And then, so do I qualify for Medicare? And if so, but what if I am still under like an employee sponsored type of health program? What parts of Medicare would I need to select if in fact I do qualify, through all the work hours and all the other provisions for that? So I think that that's a good question. And Belinda, if you want to address that, especially if it's not getting in front of your discussion, Pastor Yvette.
No, I think that's, it's excellent, because many times people don't, they say, oh, I'm still working. Do I need Medicare? Because you don't typically pay for Part A, it's recommended that you just go on and sign up for it when you turn 65, even if you're still working on your job. If you're still working on your job, however, and there are benefits on the job, you can keep those benefits. And the benefit to that is that you don't have to sign up for Part B. Part B is the doctor's part of the Medicare. If you have what Medicare deems a credible insurance through your job, you don't have to sign up for Part B. And so, well, why wouldn't I just want to? Well, there's a cost to Part B. Right now, the cost of Part B is $170.10 a month. And that you pay that to Medicare, no matter what your choices are. If you don't have credible insurance, you sign up for Medicare Parts A and Part B. Part B is your cost for Part B. But let's say your job has it where you can stay on your job insurance, and then you don't have to pay for Part B, because typically you're probably paying something on your job for their insurance. So you don't want to have to pay for their insurance and pay for your Part B. The only thing is you have to make sure that qualifies as a credible insurance. Also, with your job insurance, there's probably a drug plan associated with that plan. That's very important, because with Medicare, if you just have original Medicare, which is Parts A and Part B, you need a drug plan. Now, you're not forced to sign up for a drug plan, but Medicare says if for some reason you don't sign up for a credible drug plan when you first become eligible, and say, because you say, let's say someone says, I don't take drugs, I don't need drugs, why do I need to get a drug plan? Because if you don't get a drug plan, and then let's say 3 years from now, all of a sudden you need drugs, and now I need to go get a drug plan, Medicare, there's a late enrollment penalty. I'm sure you've heard that in all those commercials. What that says is, if you don't get a drug plan when you originally turned 65, and if you don't have one on your job and you wait, you get charged a percentage of the national average for a Part D plan for however many months you did not have the plan. So let's say the national average is $33.33. You get charged 1% times $33.33 for, like, if it's 3 years, 36 months. That's a penalty that stays with you for the full time that you are on Medicare and you have a drug plan. And so even if you have your job, then your job plan brings with it your medical and your drugs. So let's say you stay on your job until you turn 70, you keep working. So because you've had credible insurance through your job, you're not assessed a penalty because the government says you had a credible plan. So as soon as you leave your job and you lose coverage, you qualify for what they call a special enrollment period, when you can go in and pick up that coverage through a drug plan, through you can go and pick up that Part D and pick up that Part B, so that you are still compliant with Medicare. And so you don't have to have your job and Part B in a drug plan, as long as your job's plan is credible.
Another important thing too, and I saw that you had the question that was down there. But before I answer that, or we address that, is that each person who generally will qualify for Medicare, you get a nice packet that comes in the mail. It's like a library book, almost the size of a library book. So it could be very menacing to be able to go through those pages. But I would encourage you that even if a next session like this occurs, read through it. It's not like reading a novel. It's like reading a boring library book, but it's information that's going to be so critical to your future that you need to be able to highlight things in there that maybe you don't understand. So when you come to forums like this, you can ask those questions based upon your specific situation, because what we're addressing here is about generalities. So, but everyone has a different situation. And so your situation may have to have some special attention to it as well. But Pastor Yvette, I think that there's a question that was in there, and I'm not sure if that's getting in front of it, but not sure how you want to address the questions.
Well, yeah. So every time we see a question, we can just, lobby off to that, unless we know that we're going to cover that at a later time. Mrs. Stella Baker asked the question. She says, I have a Medicare supplement, but I changed to Medicare Advantage in 2023. How soon should I let Medicare supplement know that I have changed and won't use them in 2023?
You have that plan available to you till the end of December. So you should notify them in sometime in December that you are going to an Advantage plan, so they won't continue to charge you for the supplement.
That's a very good answer. I hope that answered your question, Mrs. Stella. And those of you who have questions, you might be listening to this discussion. You may have just come in this discussion. We have some great people with us today. We have Belinda Jordan, and we have also Thomas Henderson. They are what we call some of our gurus from our church, who know and understand this stuff that we do not understand. And so that's why we're having this discussion today. And Miss Estella says, thank you for the information. So thank you, Miss Estella. And those of you who are out there, feel free to put your questions in. We will get to them along the way. This is a discussion. It's designed to help you. And hopefully through the discussion, you will find some of the answers that you are looking for. So I think the thing that I want to ask the question is, and you've already answered a little bit about that, is about all of this alphabet that we're talking about. You talked about the B, and you talked about, I think you alluded to the C. What are all these alphabets about? So help us understand the Medicare supplements and determine our choices when I select.
Okay, I started talking about that. It's quite a bit to unpack, but when you become eligible, you're eligible for parts A and part B. A is your hospital. It covers your hospital costs. B is your doctor's costs, your specialist, when you need to go have outpatient surgery. And so when you have A and B, that's called original Medicare. When you have original Medicare, because it doesn't cover everything, and it covers a hospital, but it does not cover drugs. So Part D is your drug plan. If you have original Medicare A and B, then you need to go and pick up a drug plan to make sure your drugs are covered, because Medicare does not cover drugs. You have to get a policy. Typically, they're not that expensive. Drug plans are typically, depending on if you don't have a lot of expensive drug needs, you may want to pick up a basic plan just so you're compliant. But let's say if you do have some, you're on several types of drugs, When you're looking at those plans, you want to compare the plans because every company has a formulary. How that formulary works is every company has a list of drugs that they cover. Within that list of drugs, those drugs fall into tiers, tier 1 through like tier 6. So you want to know when you're looking at a plan, how do my drugs fit in the tier structure of the companies that I'm looking with? Because every company's tiers are a little different. And so you just want to make sure if you're looking for a drug plan that if you're talking to someone or if you call a company, if you call an agent or if you call a SHIP program, you want to have those drugs available so they can look them up for you for the plans that you may be considering. And so that's part D. You got your A, hospital, you have your B, which is your doctors, and you have your D, which is your drugs. Now, how does Medicare supplement fit into that? Because if you go original Medicare, A, B, and a standalone drug plan, a supplement is recommended because you have to go to the hospital, you have like a pretty high deductible, $1,600 for every visit you go to the hospital. You got to pay that $1,600, not every time, but they're called qualifying periods, and you can have more than one qualifying period in a year. It's a time frame. So let's say you have to go to the hospital for 3 or 4 days. You have to pay that $1,600 before the plan starts to pick up your hospital cost. And then after that, the cost is covered at 100% for up to 60 days. So, typically when I go through a Medicare 101, we talk about all those costs associated with having only original Medicare, which is why the Medicare supplement, and I think you alluded to this, Pastor Yvette, Medigap. Medicare supplement and Medigap are the same thing. Two different names, but they mean the same thing. It's called Medigap because it's filling in the gaps of what original Medicare does not cover. And so that's why when you're looking at a Medicare supplement plan, if your budget allows for a supplement, they're nice to have because once you're paying that supplement every month, then all that out-of-pocket costs, the supplement, depending on which plan you choose. There are multiple plans to choose from, A, B, C. There are different plans to choose from. The more comprehensive the plan, probably the more cost is going to be associated with the monthly cost. So that's important to know. What do you care about? How do you want to fill the gap around what Medicare A and B doesn't cover? So if you want to say original Medicare, you have your A, you have your B, you have your drug plan, and you may have a Medicare supplement plan or Medigap plan. Now let's talk about C. C is another option to original Medicare. C, the other name for Medicare for Part C is Medicare Advantage. Medicare Advantage and Part C are the same thing. And so when you talk about your A, your B, your C, your D, Part C is when you choose to go with a Medicare Advantage plan, like the other question person. She went from a supplement to a Medicare Advantage plan. Now those plans are also offered by private insurance companies, and why people choose to go that route many times is because the drug plans are usually included with your plan, with your Medicare Advantage plan. You don't need a standalone drug plan if you have a Medicare Advantage plan with a drug plan included. Also, with those Medicare Advantage plans, you have what they call networks. You can choose to either go with an HMO or a PPO, POS, a PFFS. You have some choices there in terms of, and it's usually based on your zip code. So if you're looking at a Medicare Advantage plan, the things you want to look at is what plans are offered in your zip code. What are the different features that those plans offer? Because they offer you things like dental, vision, and hearing. Those plans, you don't have dental, vision, and hearing with original Medicare. If you want dental, vision, or hearing with original Medicare, you have to go get out and get a separate dental, vision, hearing plan. If you go with a Medicare supplement plan, you typically will pick a plan that offers those benefits in there. They also offer things like over the counter, where you can get so much over the counter every 3 months. They offer things like transportation. If you need help with your transportation, They offer benefits like if you need glasses, and some plans will give you more towards glasses than others. So those are the things, and then you may want to look at your hospitals and your specialists. You want to make sure that your hospitals and your specialists are in network so that you can go to those doctors that you're used to going to. You can see the specialists that you want to see. That's where you get to compare plans and really see, like Thomas alluded to, which plans are best suited to meet my particular needs. And that's very important. You do have options. Sometimes people don't know they have options, but you do have options, and you're not stuck with whatever decision you make. That's why this time of the year is so important, because annual enrollment between October 15th and December 7th, that's when people have an opportunity to look at their plan. Like Thomas said, take that book out, look at it. Maybe something changed with the formulary. You need to make sure that your medications the formulary hasn't changed, that your cost hasn't gone up. That's a great time to look at, are there some things I need now that my current plan doesn't offer me? I can switch at this time. And so this is a really important time for people to kind of evaluate what's happening with their health and see which plans are best suited to meet your particular need.
Well, as I stated, Belinda is the guru. She's the expert on these particular plans. I don't work with Medicare as often as I would work with maybe open enrollment for affordable care. But I know that when I've enjoyed doing these sessions with Belinda, she has some excellent slides that can be used. And maybe that's something that can be sent at a later time, because it helps to give a graphic. And I think
Yes.
that when people see it face up, and then they can actually hear the explanation behind it, then it makes a lot more sense. But I think that our community suffers because we don't get this kind of information with such an expert like Belinda, who's able to give it in such a very common day, explanation. So I continue to learn more from her every single time. And hopefully your guests are already enjoying that. I think, Pastor Yvette, that there was a question that came up prior to that.
Mhm.
I think it had something to do with travel. I'm not sure what that question
No,
was.
that was from me. But
Oh, okay. All right.
actually, really, English. He asked the question. He says, "I have Medicare A, Part A only, so I will be penalized for the last 5 years at 33%. So I need Parts B, C, and D. My problem is choosing the right plan."
Okay, Mr. English, that's really interesting. So you say you only have Part A. Are you working? Did you have insurance through your job? Is that why you only had A? And if that's the case, then there may not be a penalty associated with picking a plan. Also, people who have, let's say, and I don't know everyone's situation, but let's say if you qualify for what we call, and this is usually based on your income. If you qualify for Medicaid, if a person qualifies for Medicaid, then that's usually based on your income. Many times the penalties would be waived if they qualify for Medicaid. That's something that, I don't know if that's the case, but let's say if worst case scenario, Mr. English, you truly haven't had any other type of medical coverage, no Part B, no Part D, then yes, there is a penalty for the Part D. That's just based on Part D for however many years you haven't had it, for however many when you became eligible for it. The Part B penalty doesn't last. There's a penalty for not having it, but it doesn't last for the lifetime of your coverage.
Well,
Only the
Belinda,
Part
he says that he's retiring.
he's
No, he's
retiring.
already retired. So, and I think that that's very important. And that might be something that's discussed maybe separately,
Yes.
because that's a very unique situation.
Yes.
I, like Brother English, I have only Part A, but that's because the fact that I am still gainfully employed and I have benefits. But that's a very unusual situation that if someone directed you to just take Part A, because as Belinda did indicate, that is generally for your hospitalizations. But the question would be, well, how are you handling the doctor's expenses whenever you have those kinds of issues? So
Right.
that might be something to discuss on a very individualized basis to help you,
Yes.
for the English, to get the right information going forward.
Yes.
And I'm posting right now Belinda's number for your Medicare questions. So if you want to give her a call at a later time, this is the number that you would use for that specific scenario, Mr. English. I think that
Yes.
that will help you tremendously. And I know that she'll be willing to talk with you during the day
Yes.
regarding
Absolutely.
that situation. Okay. So that's what we're going to offer to you. And I see that Carol indicates, she says, thank you, Belinda, for the information. And Mr. English says, he says, okay, he'll contact you. So that'll be great. So
Well,
let's go on and move on a little bit because I want to make sure that we're covering both of the subjects that we wanted to talk about today. Um, so I want to switch over real briefly to the Affordable Care Act because there are some people on here who are not Medicare eligible. They're not at that age, and they don't have insurance for whatever reasons. And so the question, that came to mind was basically, and I have this for the audience as well, is if I am in an Affordable Care Act and I have a lot of medical conditions, how do I best determine what are the best choices for me?
oh,
Yeah. Well,
Okay.
we put her on mute there for a
Yeah,
second.
got it.
Well, one of the best questions that you have for that is that when you're talking about affordable care, that's one of the things that was passed with the legislation for what was known as Obamacare, that there were no issues relating to pre-existing conditions. So when you come into that particular plan, that is not considered. So what you have to do, and in fact, when you go onto healthcare.gov, it will give you a myriad of different plans that you can take a look at, but that's after you go through a process of qualifying yourself through your application. And you can generally do that through an insurance agent who is qualified to sell those products, or what they call navigators, who are individuals that generally work directly for healthcare.gov. They can generally assist you. They cannot consult you in terms of helping you to select a specific plan, but they can help you to look at the plans, because a lot of the plans are primarily price based. Whenever you select a particular plan, you can apply to see whether or not there are tax credits that can be used to help you pay for the cost of the insurance. So let's give you an example that if you're trying to apply for a program for the very first time, let's just say you're a single individual or you're a person who has a family, then there is your income information that is put into that particular questionnaire, just to make sure that you, first of all, qualify, because some individuals don't qualify for it because of their income level, either that it's too high, or, well, I mean, not that they don't qualify, they would probably not qualify for any of the tax credits associated with the plan to help reduce the amount of the insurance. And then there are sometimes that people may not be eligible for plans within the affordable care market, and they would have to go to maybe what they call like a CHIPS program for, program for children, or to Medicaid, if they would qualify for that. But it's very important that when you're looking at these plans can be maybe like through Humana, it could be through Advocate, it could be various different kinds of companies that provide that information. But the important thing is to look at deductibles. Those plans may be affordable, but it may have an out-of-pocket deductible that just seems totally unreasonable that you can afford. You may want to be able to make sure that your doctor, that if you have a doctor that you're just committed to, that you want to ensure that that person is a part of that particular network. And that's a lot of the information that you need to be able to be ready to research as you're going through that process. And once again, there are qualified individuals that are out there that are able to help you review plans, but they they cannot suggest a plan for you to take. So I want to make sure that's very, very clear, because I know that sometimes clients will ask me, well, what plan should I take? Well, I can't make that kind of recommendation, but I can walk them through the various plans based upon their situation.
That's good to know, and that's helpful. I know that when we are looking for these things, we're looking for the answers because we are so confused by all of the information. And with the bureaucracy of our government, it's really sometimes hard to understand. I mean, I went on the site just a couple of months ago, just trying to get a better understanding, and I was confused. But the question I have now is, and that goes back to what we were talking about earlier. I think what Belinda had mentioned is that there are some people who don't qualify for Medicare or will not ever qualify for Medicare. So, are they available to go to the Affordable Care coverages, and how does that work for them?
Anyone can apply to a program for affordable care. It is the information that is put into the application that makes a determination. So if a person has a particular plan, or I think like even one person was talking about with their plan, and they decided that they wanted to go to an affordable care plan, that if they select a plan, then they have to let their current provider know that they will no longer be accepting those particular kinds of benefits as well. So it's important that those things are coordinated, because you never want to be penalized, because there are some people who will wind up taking on an affordable care plan. They get the tax credits where they're not paying any money at all for the cost of the plan. But then they find out that by keeping a prior plan, that they may have to pay money back for a particular plan that they did not cancel.
Oh, okay. Well, that makes sense. I want to let you guys know, as we're in this discussion today, we want to make it available for you to type your questions in the chat. We want to make that available to you. And whenever you want to just put in a question, and we've talked about it, or you haven't heard your answer, then feel free to come into that. And so again, I am so grateful for Thomas and Belinda, who are taking their time to be with us today. And we certainly understand that when we're working from home, sometimes all kinds of things happen. So, no problem whatsoever. We wanted to make sure everything was safe in your household. So, I totally get it. I totally get it. I remember when my son set fire in my bedroom one night when I had candles on there. He was only 2. And so, yeah, sometimes that just happens that way. So, yeah. So, anyway, as we move on, we want to go on and look at these ideas that you all have been talking about. It's been really interesting and important for us to know. We talked about what that Medicap means. We talked a little bit about even the job benefits. But in the question that I have for, and I guess this is the same question that kind of was asked in the Medicare part, but this is the question that may be to both of you guys for the open enrollment. And so the question is, if I get a job with benefits after I sign up for the Affordable Care Act, how does that work? Do I have to keep the plan for the whole year, or can I switch over? How does that work?
No, that alludes to what probably a part of what I just got through stating. And
Mhm.
so it's important the fact that you would contact healthcare.gov to let them know, that once your particular plan by your employer starts, because remember that most of the times that people who have been qualified for an affordable care plan, they may have received some type of tax credits associated with that help to reduce the cost of that. And so, if you're getting a benefit, a plan through your job, you may have to wind up paying back the costs on that, for any time that you had actually been a part of the Affordable Care Plan, and you actually had, an employer sponsored plan.
Mhm. Well, that's good to know because I know that that it was a great confusion. Even as I was reading through some things, you just couldn't tell if that was a question that had, needed to be answered. So I wanted to ask you this. This was kind of something that um, that you both alluded to is how do I know what's right for me? You talked about how looking at those plans, looking at what your specific needs are, and understanding that your needs change from year to year. If I'm real healthy this year and then I'm not as healthy the next year, there's some changes that I need to look at. And I think one of the great points that you all both made too is looking at the providers and making sure that that provider is in network no matter which choice that you make. And I think that that's really important for our discussion. And so I thank you guys for really talking about that because I think that we often rely on other people for that, and we don't really know about anything else. So I guess one of the questions I have to ask, because a lot of people get this or this happens to them a lot. Why are they getting so many questions, so many phone calls now about their insurance? What is going on with that? Anybody want to talk with us about that?
Well, what's really happening for most people that has to do with two things. What's happening with ACA, because this is open enrollment, but on the Medicare side, October 15th to December 7th, it's a big switch time. It's a time for people who have original Medicare if they want to go on to an Advantage plan. People who need a drug plan, that's the time they can sign up for a drug plan. That's also the time if you have an Advantage plan, you can change plans. And so all these companies are calling you because they want you to get on their plan, you know. So this is a big, you see all the commercials, you see all the promise you get your Part B, you get your Part B back. They just don't tell you all the little details that go along with that. But that's what that's all about. These companies this is a big time for them to, attract new clients, new customers. And so that's why everyone is getting all the phone calls. It's because this is a big enrollment.
And plus, there's still a lot of stigma around the Affordable Care Plan because some people still see it as being a political issue because the program was originally called Obamacare. Some people almost decide not to even consider looking at those kinds of plans and still go uninsured. But similar to, I know that Congress was able to fix a part of this because people were actually being penalized for not having a plan at all, financially penalized. So some of that has been mitigated, but it's very important that everyone have some type of a plan. And as I did mention, that is during this open enrollment period that you do have for affordable care, depending upon what your income level is, it's not just income, it's based upon family members, how many people are going to be covered up under the plan. That's important because that information that when you're trying to apply helps to make a determinant of the tax credits that you may be eligible for. And as I said, the good thing about that is that if you qualify, those tax credits may zero out the exact cost of the plan itself, just the cost of the plan. It doesn't zero out the plan itself in terms of you're having a copay or anything like that for your specific plan that you choose or a deductible. So I want to make sure that that's very clear that this only talks about paying for the cost of the plan that you would actually select.
That's good. Thank you so much. We have another question. Rose says that I am considering retirement well before the age of 65 and have only had health insurance through her company up to now. What is your suggestions for health insurance during that in-between time?
You want me to take that, Belinda?
Sure. Yeah.
And she can add to that. Well, you would want to start shopping some independent programs, but I could probably tell you very clearly it's going to be very expensive because, of course, that if you have had an employer, and in fact, if you look at your plan benefit that probably generally comes around this time of year, they will generally tell you what plan that you can select. And if your HR department has done it well, they're probably showing you what portion that your company is paying for and then what portion that you're paying for. You should really pay attention to the portion that your company is paying for, because you can see the true cost of that particular plan. But it's good to start researching some of those plans out there for yourself. But because of the fact that those plans are not necessarily covered up under the Affordable Care, they may have some caveats in terms of medical conditions. So that's the reason why you have to be very, very careful about selecting those kinds of external plans. But it is good to do some shopping for those kinds of plans right now, if you're interested into doing your research.
And
Belinda?
I would also add to that, because you're newly retiring, you have the income component could be a big factor when you first start shopping. Now, as you get further away and your income changes significantly, Thomas alluded to this, then you could qualify for subsidies and things like that that can bring the cost of that plan down. But I mean, as an entrepreneur, I know for myself personally, when I left employment and had the insurance through a job to go and look for it for myself, it was quite a shock when I, got how much it was going to cost me to just have health insurance. And so shopping around is very important. This is the time to do that. Thomas is exactly right about that.
The other piece of that is that as you're looking at plans, and Belinda spoke to this too, it's important that you're looking to make sure that if it's a network, but then also that if it's a PPO versus an HMO. And so if you know the difference between those particular plans, HMOs have certain requirements where you must even call in, prior to going to seek certain kinds of services, whereas a PPO may wind up giving you access to the regular doctor that you normally want to have as a part of a plan. But if you don't know, and if you don't know where to look, ask your doctor specifically, what plan are they associated with? That will help you in your research if you're looking to do something further.
That's good. Those are good answers. Mr. English comes back with a question. He says, knowing my lack of B, C, and D, would I qualify for an Advantage plan?
So at this point, Mr. English, you would need to contact Medicare through Social Security and get your B in place, because you need to have A and B to qualify for C. So in order to, you would definitely need to contact Social Security and see what you would need to do to get your Part B in place to qualify for an Advantage plan.
That's a good suggestion. And Rose says, thank you for the answering her question. We have a question here from Carol Clayton, and she says, I didn't get my Medicare book. And she said she checked her address and her Social Security number is correct. How can I get one? How can she access one if she doesn't have that big old plan that you all were talking about, that big old book?
That's the Medicare and You book. She can reach out to us, Medicare through Social Security, and ask them to let them know that she did not receive her Medicare and You book. And
I believe, Belinda, and correct me, they should be able to go directly into Social Security office in order to pick one of those up. It's a very cumbersome book. You would probably not want to read that on the computer. It's pages upon pages.
Yes.
So yeah, that would be the best that you could call to see whether or not they have them in that particular office where you're located. But that would be the best way to get that.
And probably soon too, because if you are qualifying and you're making those changes, remember that deadline is December the 7th, right?
Yes, yeah. Especially if you're on an Advantage plan, you want to change your plan, or you want to go to an Advantage plan, this would be the time to make that decision.
Well, I know that we have had you guys to talk to us, and we consider you guys pretty trustworthy. Sometimes I think that some of the apprehension is when we go to people that we don't know, to talk about these things. Who can I trust? Who can I trust to tell me the answers and not give me the answers? There's a company, I won't even mention the name because we're on the internet, but there's a company that I know that talks about all of these final expense, policies, time, and then when you look at it, you only pay so many cents a day. But when you look at the small details that are at the bottom, you realize that that's not what you're actually getting. How do they know how to trust, other than prayer and supplication, and hopefully going to people who are worthy or trustworthy? What are your
Well, the
thoughts?
best way I believe is through referral. That
Mhm.
when you have someone that you trust that has utilized the services, is just like if you needed a plumber, you would generally ask a friend who maybe has had a plumber recently that was reliable and you trusted the work that they did. That's generally going to be the best way that you can do it. And most of the times, because the fact, and Belinda, correct me if
Mhm.
necessary, like for instance, if you go into healthcare.gov, they have navigators, and those navigators don't really benefit individually from these particular plans. So I think that performance reviews they have, so they have something at stake for not being, of great integrity whenever they are providing that type of assistance. But I think, and I'm gonna speak for it again, make sure that you take down Belinda's number, make sure you write it on the walls, you put it on Facebook, everything, because she's a woman of integrity and she knows her stuff from front to back. And I'm always honored to be in the same stage with her, because it's always a learning curve that she puts me on every single time. So
Well, thank you so much, Thomas. I appreciate that. And you're right. And knowing people that you can trust. One of the things I love about what I'm doing here is helping people, because I run across so many seniors who are confused. They don't have someone to help them. They don't understand it, and there's so much to know. But there is a program, and one of our colleagues who could not be with us today. Her name is Angela. Angela
Angela Williams.
Yeah,
Hmm.
Angela works for the SHIP program. It's a program, it's actually a state funded program. And you can call that. There is called, I'm gonna give you a number. I'm gonna actually put it in the chat. But you can call a SHIP representative, and they can at least help you answer some of the questions. I love helping people, and sometimes people think, well, how much do I pay you? You don't pay me anything. Um, uh, I work for, I'm appointed with multiple companies. And so if I'm able to help you figure out what your needs are, whether it's an advantage plan or a supplement, then the companies that I'm able to help you to connect with are the ones who compensate me. So I don't want you to feel like you got to have $200 to call my digits. You don't have to do that. I'm glad to be able to serve. I love serving God's people. And so, Thomas is an example of that for many, many years in his industry as well. So, yes, referral is the best way to go, whether, to have someone who can actually guide you through the process and give you the information you need to make the best informed decision for yourself. So, thank you so much, Thomas, for that gracious recommendation. I appreciate it. But I'm going to put in here the information to the SHIP program.
Okay.
Angela couldn't be with us today, but I'll make sure that I put it inside the chat so that people can know that there are numbers that they can call. But you can always call my number, so I don't want to discourage you from doing that.
Yeah, so let me let you know. So Angela Williams has been with us in these discussions for quite a few years. Unfortunately, with a lot of things that are on her plate right now, she wasn't able to be with us tonight. But yes, the organization that she works for is amazing and very helpful, and their whole intent is to make sure that you understand what's going on. And so, as Belinda puts that information in the chat, then I'll be able to put that out for you. I think she just did. So, I'm going to put that out for you as well. This is called the Chicago senior assistants. And so I think that this is something that you have to keep in mind. This is another resource for you. These things are free, and it's always free to have a conversation. So whether or not you are talking to the senior assistant hotline, which is located now on your screen, and that number that you can talk to representatives who will be able to help you to navigate with your particular issues regarding that, or whether or not we're talking about, Belinda, and talking with her, and she, is happy to help, or whether or not you are talking about open enrollment, even if you don't go with necessarily the company that Thomas is with. I know that he'll be happy to talk to you about, some of those choices as well, because what you want to know is you want to have these numbers. I'm about to put up another number. This is called Medicare Direct. And so I want you to know that number too. This is what Belinda has gotten from, I think, Angela. So you have Medicare Direct. That number is going up on your screen right now. So you can always call them directly, because remember, this discussion is not about sales. This discussion is about you and finding the best plan that works for you, no matter who is giving that at the time. And then also, again, we're going to put up on the screen, and Thomas talked about this earlier too, is for those of you who are not Medicare or eligible for that, but you're interested in the open enrollment period that is, going to, I think, is it January 15th? Is that when is that when that is over for the open
No,
enrollment?
well, that's
When
when
is,
the plans become effective
okay, that's when they could
in
become effective.
January.
Okay.
Yes.
Okay. And so you can always consult the healthcare.gov. And so if there are no other questions, are there any other questions that you have? Because we don't want to leave this moment, but we've had this expertise of these individuals, and they have lives too. So we don't want to keep them on all night, but we don't want to go away without answering a question that might be nagging at you. Is there anything else that you guys want to wrap up and say before we say goodnight, while I'm giving them another chance to type in their questions? Some of us type much slower than others, so we want to give them the opportunity. And with the lag between what we're saying in Facebook and what they're hearing, there's about a 30-second gap. So.
Well, first of all, I want to thank you for allowing this forum to take place. I think that more churches definitely need to be able to have this type of resource for its members. We do perish for a lack of knowledge, and the knowledge is there. And I think it's very important that we make sure that we share this with other people, the people of God, so therefore that um, uh, they can be productive. We know that as we all get older, our incomes become a little bit more constricted. And so we want to make sure that whatever funds that we do have, that they're earmarked for the right kinds of things, but that it's going to help us to stay healthy mentally and physically. And again, I thank you very, very much for this opportunity, and always a pleasure and an honor to line up with Belinda on this.
Yes.
Thank you,
And
Thomas.
I hope that we can maybe in the future do the Medicare 101 information session that Thomas referred to, because I find that people, even who've been on Medicare for years, there's so much information there that they did not know. And so I think it benefits all of us to just, some stuff we can't hear enough because it's so important, not only for the person who's maybe eligible for Medicare, but for family members. Many times I run across seniors and they're in their 80s and they're just not in a position to make some of those complicated decisions on their own. So their families really need to become educated as well, so they can support their loved one. And so education, you don't have to wait till you're 65 to get this information, because you can help someone else who may need the kind of support that you can provide for them. And that's, I think, in our community as believers, we have to be willing to help each other. especially our seniors, who's our vulnerable population.
That's right.
Absolutely, absolutely. Um, Estella says, thank you so much for the information, you guys. Mr. English says, thank you for the valuable information. He looks forward to talking with you offline and get the right plan for him. And Deborah Coleman, she says, I have insurance to my job as well, but it's good to know what to expect when I get to that age. And thank you for the information. So I am so grateful to you guys again for your time. Thank you so much. And my prayer for both of you, because you all give so much in this and you all have done this. This is the third year that we've done this together. I want to just pray that God will prosper you, prosper your lives, your spouses, your children, your grandchildren, anybody that's around you, because of the integrity that you have given and the time that you have. You don't really have to do it, but because of the God that's in you, you're doing it. And we find that to be so wonderful. So my prayer is that you will prosper and be in health, even as your soul prospers, and that you will prosper financially, because we want to make sure that you all have everything that you need, because you have taken care of the people of God. So thank you so much for your time today. And for those of you who've tuned in, I hope that if you know that there is somebody who had missed this discussion and you thought that this was valuable for you, that you will share this to your timeline, and not only share it to your timeline, but also, make a little statement saying that if you are interested in open enrollment, or you're interested in Medicare, and those changes that take place, that this is for you, because this is really important information, and this is something that will be a blessing for you and for the people that are around you. So thank you so much, everyone. Thank you guys for joining us, and God bless you all, and have an amazing day as we continue to develop our lives together. And I pray that you all have a wonderful holiday too, because
Yes,
we got that,
yes.
got that
Yes.
Turkey Day coming up, and I don't know if a lot of us eat that turkey anymore, but we're definitely glad for the opportunity for you guys to be with us today. So God
Thank you
bless
very much.
you, and
Thank
have
you
a
so much,
wonderful,
Pastor Pat.
wonderful day. God bless you.
God bless you.